Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. So, when it comes to the unregulated and unbearable world of alternative medicine quackery, we see a lot of buzzwords that get thrown around that appeal to impressionable idiots just waiting to be separated from their money. Oftentimes, when medically unqualified people try to establish their own ridiculous theories about treating various ailments, they'll bring up woo phrases like leaky gut, adrenal fatigue, blood flow, and of course the latest buzzword, which is also the subject of today's video, inflammation. Now, that is of course not to suggest that inflammation is some bogus concept. Of course, it is real, but oftentimes it is attributed to out of context to conditions where its presence has no influence on either the progression or treatment of the condition in question. This, of course, also applies to hair loss. You see, hairline fraud cells and snake oil salesmen will often make themselves sound convincing in their sales approach by mixing in some genuine scientific information into their fraudulent health claims to give a veneer of legitimacy. A common example of this is for them to concede some scientific evidence as being valid, but then claiming it only partially addresses the problem and that they have some alternative explanation that fills in the gaps that the conventional medicine doesn't do. In the case of hair loss, what you'll often hear these hairline fraud cells say is, sure, of course DHT causes hair loss, but that's only part of the problem. You also have to address the inflammation, and conventional treatments like finasteride and minoxidil are not going to be enough because they don't stop inflammation. So this makes the hairline fraud cell seems credible since he acknowledges some of the research behind hair loss in DHT as being legitimate. So maybe there is something to this hypothesis about inflammation being another often overlooked component of the hair loss equation. So is this true? Is fighting hair loss not just a simple matter of controlling DHT on the scalp? Does controlling inflammation also help, or is this just more broccoli designed to scam people out of their money? Well, let's go ahead and brew some potions, make some moon dust bombs, and oil our blades as we go balls deep into this theory and find out once and for all whether inflammation is something we need to worry about when it comes to fighting hair loss. So before we start all this, let's define what inflammation is exactly, because oftentimes people just assume inflammation is something that is automatically bad, even though it is much more nuanced than that. For instance, we usually think of inflammation as being part of the normal healing process after an injury, and that's a good thing. If we got a cut in our skin, the area gets all red, swollen, and tender. The redness and swelling happens because there is an increase in blood flow to the area, while the tenderness is because of the prostaglandin release, which increases the sensitivity of nerves to pain. This keeps us from touching the area while it is healing. You might see some pus, which is due to various white blood cells coming into the area to fight off bacterial infections, and eventually this all resolves and a scar forms. So basically the inflammation process is just a healing mechanism. It is a very complex process involving lots of different molecular signaling pathways, hormones, immunoglobulins, clotting factors, and different cell types. But despite being a painful and ugly process, acute inflammation is a good thing, and we certainly would live very short lives without it. But besides acute inflammation, there is also chronic inflammation, where there is a low-grade but active inflammation going on for long periods of time. This type of inflammation is not beneficial. In fact, it can cause tissue damage and do more harm than good. There is an element of chronic inflammation in most chronic diseases, such as diabetes or heart disease. Chronic inflammation also is the cause of autoimmune diseases like lupus and rheumatoid arthritis. There's even a form of hair loss called alopecia areata, which is an autoimmune disease, and it is due to chronic inflammation. So at least in that case of hair loss, we could say for sure that inflammation does play a role, and it can be treated with drugs that suppress inflammation like JAK inhibitors or corticosteroids, and I have made some videos about that which I'll link below. With chronic inflammation, the types of white cells involved are different than those in acute inflammation. In acute inflammation, the predominant white cells are called leukocytes, and they are like the first responders to injury. With chronic inflammation, the white cells are lymphocytes, mast cells, and plasma cells, and these cells secrete inflammatory proteins called cytokines, immunoglobulins, and other factors that can actually injure the cells. So chronic inflammation, unlike acute inflammation, is a bad thing. So this all raises several questions. Does chronic inflammation play any role in androgenic alopecia? And if it does, is it a cause of hair loss or just a consequence of hair loss? In other words, is the inflammation inflammation just a reaction to the damage DHT does to the hair follicles, or is inflammation itself actually causing the damage, or is a little bit of both factors maybe? Is it possible that inflammation is just little more than a downstream effect of DHT, meaning does DHT itself trigger the inflammation directly, or could it be, as the hairline fraud cells like to believe, a separate process completely that is independent of the effects of DHT on the hair follicles? So let's try to address all these questions here today, chums. The first fundamental question is whether chronic inflammation is even present in androgenic alopecia at all. Originally, it was felt that there was no inflammation in androgenic alopecia, but then it was discovered that the immunosuppressant drug called cyclosporine was very, very effective against hair loss. Now, this turned out to be a red herring because the effects of cyclosporine on growing hair has to do more with the non-immunologic effect on the Wnt pathway, that's the WNT Wnt pathway, and I did a video on this which I'll link below if you're interested. But anyways, this got researchers looking under the microscope at the scalps of people with androgenic alopecia in order to see if there were signs of inflammation going on in their scalps. So, what did these researchers find? Well, this article here reviewed the studies that have been done looking for inflammation in androgenic alopecia. And in these studies, lymphocytes and histiocytes, which are white blood cells that are present during chronic infection, were seen in 36% to 71% of tissue samples from people with androgenic alopecia. So it does look like there is some chronic inflammation in some, perhaps even in the majority of people who have androgenic alopecia. This seems significant, but keep in mind that not everybody had inflammation, so clearly having chronic inflammation is not a necessary condition in androgenic alopecia. So these studies suggest that chronic inflammation is not a root cause of androgenic alopecia. Otherwise, you would see inflammation in everybody who has the disease, which isn't the case, obviously. Now, in some studies, there was a control group without androgenic alopecia, and in most of these studies, there was less inflammation in the control group than in the group with androgenic alopecia. For example, in this study right here, the highest number of inflammatory infiltrates and mast cells, which is a type of inflammatory cell, was seen in actively balding areas on the vertex of the scalp, while in the occipital region where the hair appeared normal, there were fewer inflammatory cells. Interestingly though, there were even fewer inflammatory cells taken from the scalp samples of people without androgenic alopecia. Surprisingly, this suggests that even the normal appearing hair in people with androgenic alopecia isn't quite normal. There may be some very low grade inflammation going on, suggesting the pattern in pattern hair loss is not a strict demarcation between normal hair and abnormal hair. Rather, androgenic alopecia is more of a diffuse process. Sometimes it does manifest itself diffusely, particularly in female pattern hair loss or in men who have diffuse hair loss or retrograde alopecia, where the involved hair is along the sides of the head and not on the top. Also, it is important to keep in mind that the occipital region of people who have classical male pattern hair loss is resistant but not completely immune to androgenic alopecia, which is why people who get hair transplants are still encouraged to use finasteride in order to prevent the transplanted hairs from miniaturizing. This is especially true in people who have really aggressive Norwood 7 patterns, since they'll only have a very small ring of available donor hair, and even much of their occipital region will be susceptible to DHT damage. Anyways, I should emphasize that even though there was some evidence of inflammation around the hair follicles of balding people, the amount of inflammation that was seen is still relatively minor. As this article says here, quote, "No inflammatory infiltrates were observed around the majority of the bulbs," unquote, meaning this is a very low-grade inflammation we're talking about here. So, in this study, the authors concluded that inflammation may play a role in hair loss in people with androgenic alopecia, but not all investigators have confirmed these findings. For example, in this more recent study from 2020, 37 specimens from scalps of people with androgenic alopecia were compared to 45 scalp samples from control subjects. Signs of chronic inflammation were found around the hair follicles in 73% of subjects with androgenic alopecia. So that may make it sound like inflammation really is associated with androgenic alopecia, but is that really the case? Well, not so fast, chums, because in this study, inflammation was found in 84% of control samples who did not have androgenic alopecia. Basically, there was no difference between the two groups in the amount of inflammation seen at all. So based on this, the authors of the study concluded, quote, "Based on our findings, we suggest that inflammation and fibrosis may not play significant roles in the pathogenesis of pattern hair loss," unquote. So in these studies looking for signs of inflammation by looking under the microscope, there is some controversy over how much inflammation is present in androgenic alopecia and whether it plays a role in the hair loss process at all. However, besides just these cell studies, there is some data, though it is very limited, that suggests that proteins and signaling pathways that are involved in inflammation are activated during androgenic alopecia. In this study here, gene sequencing was done on scalp biopsies from 5 people with androgenic alopecia and compared with controls. So not a large sample size, but the results were very interesting. The androgenic alopecia subjects were divided by Norwood scale, meaning they were basically divided between the less than class 5 and more than class 5 on the Norwood chart. So the subjects with lower Norwood class were considered to have earlier stages of the disease, and the subjects with class 5 or above had later stages of the disease. Anyways, 3 proteins called WNT7, CASP7, and TNF were found to be increased compared to controls in the early stages of androgenic alopecia and actually decreased in later stages. WNT7 is part of the WNT Wnt pathway that I've talked about in previous videos, and it is important in order to induce the anagen growth phase of the hair follicle. However, CASP7 and TNF are proteins associated with inflammation and apoptosis, which is programmed cell death. So the analysis here is that early on in androgenic alopecia, the Wnt pathway is activated, but there is also more inflammation triggered by the caspase protein CASP7 and by TNF. As androgenic alopecia progresses, inflammation slows down and is replaced by fibrosis as the hair follicles die, and the Wnt pathway also is suppressed so that the anagen growth phase is delayed or disappears entirely. So what causes this inflammation? Is it a lack of blood flow and we can all solve it by standing on our heads and massaging our scalps like a bunch of complete idiots? Well, no. As it turns out, the culprit is the usual foe for us hair loss witchers. That's right, I'm talking about the trash hormone DHT. We know from studies of the prostate gland and benign prostatic hyperplasia that DHT triggers inflammatory factors like TNF-alpha, IL-8, and other factors as well. On the other hand, lowering DHT with 5-AR blockers reduces these inflammatory factors and reduces inflammation, as outlined in detail in this study right here. This study reviews how some of these various inflammatory pathways induced by androgens can affect the hair growth cycle. For example, the cytokine inflammatory pathway contains substances like IL-1 and TNF-alpha that are known to induce premature entry into the catagen transition phase, which results in cutting short the anagen growth phase of the hair growth cycle. These inflammatory agents also trigger reactive oxygen species that can damage the hair, as well as triggering apoptosis, which is what happens in the catagen transition phase of the hair follicle, which is when the anagen growth phase transitions into the telogen resting phase and causes hair loss. TGF-beta, which has both pro-inflammation and anti-inflammation properties, is overproduced by dermal papilla cells in the hair follicle in the presence of androgens, and TGF-beta is a negative growth factor that halts hair growth and plays a role in follicular fibrosis and miniaturization. Another factor besides DHT itself that might cause inflammation is a factor that contributes to acne too. That factor in question is the bacterium Propionibacterium acnes, which is found in acne lesions. Acne, of course, is very inflammatory, and part of the inflammation is a reaction to this bacterium that inhabits our pores. Well, it's no surprise that if this bacterium can inhabit small places like our pores, that it can also inhabit our hair follicles too, and indeed it does. However, it is surprising that it may be more prevalent in people with androgenic alopecia. That is what this particular study found, at least. The researchers found no difference in the types of bacterium found in the middle and lower parts of the hair follicle between the subject with normal hair and those with androgenic alopecia when looking at hair follicles that had not miniaturized. However, when looking at miniaturized hairs in androgenic alopecia subjects, there is much more Propionibacterium acnes present, particularly in the middle part of the hair follicle. So could this acne bacterium trigger some of the inflammation in these miniaturized hair follicles that then leads to fibrosis and then eventually the slick, bald toilet seat look, you may wonder? Or maybe this is just an incidental finding, meaning that miniaturized hair follicles have a particularly inviting environment for this particular acne bacteria. The study does doesn't answer this question as to whether these bacteria play a role in miniaturizing the hair in these follicles or whether they are just an incidental finding that doesn't contribute to hair loss in androgenic alopecia. So getting back to the article I mentioned before, the authors of the study seem to feel that chronic inflammation is an aggravating factor in androgenic alopecia, and that this inflammation is caused by environmental factors like UV light from the sun, smoking, alcohol, and even chronic stress. I was wondering why they were stressing these very questionable contributors to hair loss, and that is when I noticed that the senior author of the paper, Dr. Sophia Kogan, is from Nutraceutical Wellness Incorporated. You can tell this study is complete BS just from the word nutraceutical alone, but it gets even worse than that. Dr. Sadick, the first author, is, quote, the clinical investigator of the product, unquote. Wait a minute, what product are we talking about here? Well, here in the last part of the paper, we find out that this is actually a two-part paper. The last sentence of the next text says, quote, in the next section, we will review these novel therapy options, focusing on standardized nutraceutical with their unique potential for synergistic, multi-targeted action of scientifically studied botanical phytochemicals, unquote. In other words, these authors are just pushing bullshit natural alternatives to finasteride and minoxidil, so naturally they think the key to hair loss is inflammation and that botanicals, phytochemicals are all the solution to the problem. Yeah, like we've never seen anything like that happen before. The fact is, there isn't any good data that targeting inflammation is very effective in treating androgenic alopecia. In fact, some people have promoted corticosteroid injections in androgenic alopecia, which are far stronger anti-inflammatories than any of this natural phyto-botanicaceutical crap that they all like to promote. But even with these far stronger anti-inflammatories, there is absolutely no evidence whatsoever that anti-inflammatories do anything for hair loss at all. Now, it's worth mentioning that there are some small studies looking at antibiotics and antifungal agents like ketoconazole for the treatment of androgenic alopecia, and ketoconazole still remains a fairly popular hair loss treatment in the form of Nizoral shampoo, although its hype has died down considerably over the past 10 years. Although ketoconazole is an antifungal agent as well as an anti-inflammatory agent, it also blocks the androgen receptor. So even though there have been some small, non-randomized studies indicating ketoconazole may have some small benefit for treating androgenic alopecia, it's likely that some of the beneficial effects are through the same androgen mechanism that finasteride works by, since ketoconazole is a weak androgen antagonist. This article here reviews these studies, and if you're interested, I did do a video on ketoconazole, which I'll link below. So I think there is probably an element of chronic inflammation in androgenic alopecia, and this contributes to the destruction of the hair follicles, but I think that the evidence suggests that this inflammation is either secondary to the injury that DHT causes or is a downstream effect of DHT, which affects pathways that have to do with inflammation, like TGF-beta, cytokines, and others as well. In other words, inflammation itself is not what is causing hair loss. It is just a byproduct of it. And I also think inflammation, that element is very minor, if anything, and there is no good evidence that treating inflammation will help you if you have androgenic alopecia. If you have androgenic alopecia and your scalp is itchy, you might have a fungal infection, in which case a simple antifungal shampoo like Nizoral will help, but this has nothing to do with androgenic alopecia. So I know a lot of ass clowns in the hair loss community who think they know hair loss science better than researchers will try to sound all clever and all by bringing up all these alternative theories like scalp tension, the 3-AHSD broccoli theory, or the classic blood flow theory, and you can go ahead and add inflammation to the fail basket of debunked bro science. The truth is, though, is that DHT is 100% of the problem. Sure, you can point to some downstream effects of DHT like inflammation or the effects of DHT on the Wnt pathway or on growth factors like IGF-1 or TGF-beta 1, etc., etc. But the fact is that the common denominator of all these problems is still DHT. You get rid of DHT, you get rid of all the downstream effects, and you solve hair loss completely. That's all you need to do. We know this because in the research fields which led to the development of finasteride, 13 families in the Dominican Republic were found to be lacking in the type 2 5-AR enzyme through a genetic mutation, and amongst them, none of them had hair loss at all. That is because DHT is what causes hair loss, and that is it. Hair loss is not some big enigma where we're still trying to put the pieces together and find out what causes it exactly. We already know what causes it, and we've already developed treatments that successfully stop it, by going after the root cause of the problem, which again is DHT. People may try to counter this by saying things, oh yeah, Kevin, well, if that's the case, then why do some people still lose hair on finasteride and dutasteride? Well, first of all, most of these people are full of shit. You'll notice that 99% of the time when people make these claims, they have no photographic evidence to back it up, and that is because they're not really losing their hair. What is much more likely to be happening is that they're panicking about a shed because they don't understand how hair cycles work. Nothing wrong with that, but your doctor probably should have explained it to you, or more likely these people are self-medicating and taking the drug without any knowledge about its mechanism at all. The truth is, though, is that yes, you will shed if you are on treatment, and yes, these sheds can happen multiple times because it is not possible to keep any hair in the anagen growth phase permanently. The sheds will be worst when you first start treatment since you'll likely have more hairs in the telogen phase, but subsequent sheds will not be as severe since there will be fewer telogen hairs. The fact is, though, these people online claiming they're losing hair on finasteride or dutasteride are almost entirely full of shit. Tell them to either provide photographic evidence to back up their claims or shut the hell up. You are being trolled here. These people are not losing hair on treatment. They're just hypochondriacs who are fear-mongering, so please just ignore them. Anyways, if you want to learn more about the hair growth cycle and shedding, check out my video on the subject, which I'll link below. In the very, very rare case, though, that someone really is losing hair while they're on treatment, it just means they need a stronger 5-AR inhibitor, because remember, finasteride only suppresses about 40% of scalp DHT. That's enough for most people, but the next step is dutasteride at 0.5 milligrams daily, which suppresses 50% of scalp DHT. And beyond that, you can safely titrate the dose of dutasteride up to 2.5 milligrams per day to suppress 80% of scalp DHT, which should stop hair loss in just about everybody. Anyways, if you want to learn more about proper finasteride and dutasteride dosing, check out my videos about them, which I'll link below. So, in summary, stop trying to think outside the box for treating hair loss. Think inside the box. The truth is, inflammation is not even a partial solution to hair loss. It is just a distraction, and you're going to be wasting time, money, and hair going after an unrelated problem. Sometimes the simplest answer really is the correct one, and not everything is a conspiracy theory. Yes, fighting androgenic alopecia is just as simple as stopping the goddamn DHT. People who try to tell you it is more complicated than that are just trying to scam you because they aren't going to be making any money off of you when you're using treatments that actually work. Anyways, I think that's about all I have to say about the subject, so don't worry, I've got some more preem contents coming soon, but until then, I'm going to go ahead and delta the hell out of here. Take care, God bless.